Hello, I'm John Gangwon, a vascular transplant surgeon from the Catholic University of Korea Bucheon St. Mary's Hospital. Today we're going to talk about peripheral arterial disease. In simple terms, peripheral arterial disease is also called central arterial disease. Let me explain. Coronary artery disease is described as the obstruction of the arteries of the heart caused by atherosclerotic plagues. The same process applies to the arteries of the aorta, arms and limbs, and the rest of the lower extremities. This is what we call peripheral arterial disease. There are other cardiovascular diseases that are comparable to a peripheral arterial disease, including atherosclerosis, which is the narrowing of the arteries due to cholesterol buildup. The blocking of the inner wall of the arteries may restrict blood flow and may cause severe pain. The blockages may lead to rupture of the arteries. Another condition, the brain aneurysm, is described as a dilation of an artery due to weakened linings of the wall. Aneurysms are dangerous when left untreated. As we age while having weak blood vessel walls, tendency is it may swell unknowingly. There's a chance that the bulge vein will become enlarged and progresses into a rupture. It can lead to fatal situations as the symptoms are often invisible. There are many causes of getting a peripheral arterial disease. For example, it's common for people who smoke a lot of cigarettes. It's also common in many older people, in particular men more so than women. Also those with underlying medical conditions such as high blood pressure or diabetes, then those with congenital heart disease, and those with hypertension. Peripheral arterial disease may jeopardize one's health in future as it can be one of the leading causative factors that leads to death. If the patients decide to visit for a checkup, the first thing to do is to help them identify the symptoms that cause them pain. The most common symptom that we can easily come up with is called claudication. Lameness or pain occurs when the patient walks or tries to move their arms and legs. It's also a condition that causes soreness and pain in the thigh and buttocks due to limited blood flow. It's a major symptom that indicates peripheral arterial disease. We can spot claudication by letting the patients walk. The shorter the walk, the greater the severity. In addition, beyond claudication, there are much more visible symptoms. For example, the patient has a wound on the foot and this does not heal for 2 weeks or more. This is because the blood vessel itself is narrower, causing an extreme decrease in blood flow, making it incredibly painful for patients who have to deal with the wound for a longer time. After recognizing the symptoms, we can start a physical examination. We start on the femoral artery or popliteal artery. After that, we palpate the arteries in the back of the foot, and if it is found weakened, we'll then automatically perform an ankle brachial index test. This index test measures blood pressure in the arms and legs. It's to measure or monitor the blood flow going down to your lower extremities. If the result of the index test comes out below 0.9, it's considered abnormal, as such result indicates the patient has arterial disease. At this point, we'll be performing several imaging tests that include ultrasound and CT angiography, which can detect arterial diseases. In the case of ultrasound, it depends on the ultrasound proficiency. Sometimes the test results are slightly different than what was expected. You can also see and monitor the blood flow in the blood vessel wall because it is impossible to determine how narrow the blood vessels are due to the imaging test. Ultrasound in this case is pretty important. The next thing that can be done is angiography CT. Angiographic CT is done by injecting a contrast medium intravenously to get an image of the arteries. You can instantly see the overall shape and state of atherosclerosis on the blood vessels. As it allows you to view the inside of the arteries, it can be seen as a very useful tool for diagnosing vascular diseases. Treatment for peripheral arterial disease can be divided into 3. First, we'll take up on the subject of treating claudication symptoms in patients. In the case of mild claudication, we can try to treat it with the help of medication first. Antiplatelet drugs may be used for treatment. If patients respond to this by administering a drug called vasodilator, we can be assured that their blood circulation can be improved, which means medication will be continued. For those who have wounds in the lower limbs or extremities that don't go away for days or weeks, and necrosis is already progressing, blood vessel CT will be performed to see blocked arteries inside the body. And if your arteries need to be repaired, you can decide to open them through a medical procedure. As said before, there are many vascular surgeries to open the blood vessels, and a way to bypass blood vessels is through performing a graft. And the method of treatment depends on the severity of occlusion of blood vessels as well as assessing the degree of atherosclerosis. It also depends on the site where the patient's wounds are and the extent of its severity. The scope and method of treatment is determined upon examining the extent of the treatment needed by the patient. During treatment, most patients go back to their old habits, which is definitely harmful, especially for elderly patients who smoke a lot during the day. So first thing you need to do is quit smoking. And of course, the many causes of peripheral arterial disease. As mentioned earlier, there are underlying diseases such as hypertension, diabetes, hyperlipidemia, and many others. They have to be kept in control through treatment, and then we put a stent to maintain circulation. And if you've undergone tracheostomy or bypass surgery, then you'll need a follow-up. In order to maintain the patency of the stent and avoid dysfunction, it's recommended to thin the blood itself to avoid clogging after placement. With this method, you'll continue to take antiplatelet medications in order to improve blood flow to your peripheral arteries. You also need to take your vasodilators properly and on time. There are cases where patients are reluctant to take these drugs, but you have to keep taking it unless ordered by your doctor to stop medication. And after surgery, patients must practice self-care. If you experience pain in your lower extremities, especially your legs, try to sit still and not move. You need to have time to rest too. Exercising continuously for at least 30 minutes a day can help in the increase of blood flow in your arteries and keep you healthy. And that's what we learned today about peripheral arterial disease. Thank you very much.